Hello everyone, in today's video we are going to discuss about probe positioning in kidney ultrasound. It means in today's video we will learn how to do ultrasound of the kidney. So if you keep the probe like this in the mid axillary line, then we see this type of the image. Here in this image, this is the kidney of the patient and this is the liver. So space between kidney and the liver is hepatorenal space. So this is the hepatorenal space. So liver is usually homogeneous structure in the anterior and the superior aspect of the kidney. So this is liver. The outer part of the kidney is called renal cortex. So this is renal cortex. This hyperechoic structure is the renal sinus. So renal sinus usually appears hyperechoic because renal sinus contains fat and fat is echogenic in ultrasound. So this is renal sinus. So just below the renal cortex there is hypoechoic area. So this is the medullary pyramid. So medullary pyramid is hypoechoic than the renal cortex and the echogenicity of the cortex and medullary pyramid is different. So this is called corticomedullary differentiation. So this is the finding of the normal kidney. If the echogenicity of the renal cortex and medulla is same, then this is called poor corticomedullary differentiation, and this is the finding of chronic kidney disease. Sometimes visualization of the entire kidney may be difficult due to rib shadow. In that case, if we tell the patient to take a deep breath and hold, the kidney will be pushed downward, and that will help to visualize entire kidney. So once we visualize the kidney, then we have to tilt the probe anteriorly and posteriorly to assess the entire kidney. So from this position, if we tilt the probe slightly, then we see this type of the image. So this is the renal cortex, this is the medulla, this is the renal sinus, and this is the upper pole of the kidney and this is the lower pole of the kidney. So once we visualize the upper pole and lower pole, then we can take the measurement from upper pole to the lower pole to measure the length of the kidney. If we rotate the probe 90 degree counterclockwise like this from this position, then we see this type of the image. So this is the transverse view of the kidney. So here in this image we can see this is the renal sinus, this hyperechoic area is the renal sinus, this is the renal cortex, outer part is the renal cortex, and this is the medullary pyramid. So once we see this type of the image, we have to tilt the probe superiorly and inferiorly to assess the entire kidney. So this is the transverse view of the right kidney. In this image, we are trying to visualize left kidney in longitudinal view. So if we put the probe like this in the posterior axillary line in left side, we see this type of image. So this is the spleen. In right side, we see liver in this area, but in left side, we see spleen. So echogenicity of the liver and spleen is almost similar and both are homogeneous structure. So this is the left kidney. If we tell the patient to take a deep breath and hold, we can better visualize the kidney. So if we rotate the probe in 90 degree counterclockwise from longitudinal position, then we see this type of the image. Image will be almost similar to that we see in right side. So this is the transverse view of the left kidney.